views and opinions expressed in this program are those of the participants and do not necessarily reflect the views of BronxNet or the program underwriters.
And hello, welcome to Open, the show that opens the Bronx and the rest of the world to you. I'm your host, Daren Jaime. And today we'll update you on what's happening in and around our borough, as well as across New York City. Coming up, a conversation with Assembly members Victor Pichardo and Nathalia Fernandez on the initiatives they're taking to provide aid to students and discuss how the coronavirus is impacting their district. And then later, there are new financial reliefs in place for employees affected by COVID-19. We're going to discuss the coronavirus, aid, relief, and economic security and other reliefs that are available a little later on in the show. After that, we'll learn with the representative from Washington Heights Wellness about simple steps for protecting your immune system, improving your overall health, and providing a sense of control during this pandemic. Well, then as the fatality rate continues to increase in New York City and funeral homes unable to meet demands, we'll speak to the director of the Hart Island Project about information concerning burial procedures on Hart Island and what the program is all about. So stay tuned because all this and much more is heading your way. Right now, we're officially open. And hello, everyone. I'm Daren Jaime. Today is Wednesday, April 22nd, and you're watching Open, a live program that brings the Bronx and New York City straight to you. We also want to thank our viewers on Manhattan Neighborhood Network, as Open is now being broadcast simultaneously on the Eminence channel. You can also stay connected to us on all of our social media platforms at BronxNet Television. Well, a lot has certainly been going on through the past week. We're going to take you through it with some Bronx updates. And we're continuing our coverage of COVID-19, and New York State Governor Andrew Cuomo issued a statement stating that New York State's recent new coronavirus hospitalization, ICU admission, and fatality numbers are starting to suggest that the state is coming out of the peak of the outbreak. The governor said, quote, "The recent news is good that we're on the other side of the plateau and the numbers are coming down, but that's good news only compared to the terrible news that we're living with, which is that constant increase." Now, Governor Cuomo did announce the plan to unpause New York and also reopen the economy, saying the state will focus both on antibody and diagnostic testing. The governor stated, quote, "Any plan to start to reopen the economy has to be based on data and testing, and we have to make sure our antibody and diagnostic testing is up to the scale we need so we can safely get people back to work." The Department of Health conducted a statewide antibody survey, and the survey sampled 3,000 residents across the state, getting an accurate assessment of the rate of COVID-19 infection and recovery. Large-scale antibody testing will help determine the percentage of the population that is now immune to the virus, allowing more individuals to safely return to work. New York State Attorney General Letitia James took to action this in blocking debt collectors from taking stimulus checks from New Yorkers. Attorney General James issued an official guidance to New Yorkers' state banking institutions, as well as creditors and debt collectors, making it clear that financial relief provided through the stimulus payments are exempt from garnishment under New York state law. The U.S. Department of Treasury authorized the CARES Act, sending billions of dollars to Americans struggling as a result of the economic fallout from COVID-19. Now, Attorney General James says, quote, "As the coronavirus continues to wreak havoc on our society, I will do everything in my power to protect the wallets of every New Yorker. Today, we're taking concrete action to ensure the debt collectors keep their hands off of New Yorkers' stimulus payments. Now, the official guidance makes clear that no banks and debt collectors can freeze or seize stimulus funds that are on their way to families, and any institution that violates this guidance will face swift legal action from my office. Well, in other news, Bronx students are in the midst of COVID-19, and they're dealing with the issue of technology and proper equipment. Community leaders and educators are now advocating more technology and more equipment for Bronx students. Our BronxNet reporter, Sanji Lopez, has the story.
Since New York City schools shifted to distance learning in March, students are expected to join their teachers and peers virtually. But what about students in underserved communities without readily available access to technology or internet service? In a recent poll by the Education Trust New York, families identified a lack of sufficient devices at home. 52% cited a lack of reliable internet access, while 64% said it would be beneficial if schools were to lend out mobile devices for educational purposes.
There are children who were not giving laptops, were not giving tablets, and their school is solely doing remote work. When I'm hearing elected officials and folks saying like, oh, remote learning is going so well, I'm like, well, how are we measuring this?
Unfortunately, for some of my students, there's only one device in the household and there may be several children. So they have to share amongst one another. So at times there's a challenge with staying connected with them, and also they have challenges completing some of their work.
In an effort to advocate for technology and internet access in Mont Haven, teachers and students at PS 369 began special projects like writing letters to their local council members.
We don't have one of those things. We will basically have nothing else to do for school because we can't go back to school because of the coronavirus.
The city council members should take a step and fix the situation, because the mayor announced that schools will be closed for the rest of the year and they won't be able to do work for the rest of the year.
East Side House Settlement has also begun gathering tablet donations for children in the South Bronx, particularly for those who live in shelters with little to no access to Wi-Fi.
It's not just kids in the shelter. It is kids throughout New York City right now, specifically in the South Bronx. We talk about summer learning loss. Kids lose reading levels over the summer. They lose 2 to 3 reading levels over the summer. School is not going to be open back until September. So that means at that point, we will be 6 months. So if kids lose 2 to 3 reading levels in 2 months, what is going to happen in 6 months?
Reporting for BronxNet, Sanji Lopez.
Thank you, Sanji. And we'll have more news coming up on Open right after this.
Who's most at risk for coronavirus? People over 65, people with underlying medical conditions like heart disease, chronic lung disease, asthma, diabetes, people undergoing cancer treatment, and people with weakened immune systems. What should you do if you or a loved one is at higher risk? Avoid close contact with people, avoid crowds, stay home if you can, wash your hands frequently, learn more ways to protect yourself and others at coronavirus.gov.
And we are back here on Open. Daren Jaime here with you, and we are continuing to bring you content. And of course, it's not the way that we normally have it in studio. All of us have to come virtually, but we're grateful that we can still be able to bring you a virtual show, bringing you news, information, and the things that you actually need to know during this time as we all try to navigate the effects of COVID-19. And when we talk about COVID-19, so many people are affected. We talked about school students, right? And we talked about elementary school and how they've had to adjust to online learning. But when you take it up one step further, we go to college students, and college students have been adversely affected when it comes to being able to do distance learning and online learning. And so we've got 2 assembly members that have been working very hard and very diligently in helping particularly students at Bronx Community College be able to navigate that digital divide. And we're pleased to have 2 very special assembly members Nathalia Fernandez, who is from the 80th District, and it's good to have you as well. And then we also got Assembly Member Victor Pichardo from the 86th Assembly District. And both of them have been very adamant and strong supporters of Bronx Community College, providing grants so that way we can have that digital divide, that gap closed a little bit. And so thank you most for coming and sharing with us here on Open. Good to have you both. 2 at one time.
Yes.
Yeah, so we're gonna make this work. So I'm gonna go ladies first, right? And Assembly Member Fernandez, please talk to us a little bit about BCC, because you guys felt it was important to really tap into BCC and to be able to do some things for students.
Absolutely. Well, BCC is our, one of our historical institutions, a great institution that has done so much for students in the past, and we're trying right now. And, we want to keep that momentum for the future, near and far. And, the transition to remote learning was a shock to a lot of us. We saw our elementary schools and high schools, adapting to it. The city quickly went to purchase more tablets and laptops, still not enough, but I do believe it was forgotten for our college students, in our CUNYs and all that, and making sure that they have the laptops, because the difference is colleges have a campus, and anybody that didn't have the means, they could stay on campus and utilize the resources there. But now that we're stuck at home, it really limited a lot of students, students in my district, I know Victor's district, all over the Bronx, really, and something had to be done. So to be able to help a little bit right now with what we have was really important, because this is the time to just make sure everything possible is possible right now.
Yeah, and it's great because so many people are coming together, and Assemblymember Pichardo, talk to us a little bit about that importance, because when we talk about BCC, it is that engine towards upward mobility, right?
Sure. Well, first of all, this is something I want to thank my colleague, Assemblymember Fernandez, for supporting the students, not only a lot of her constituents, but many of mine who attend this hallowed institution. First of all, when we spoke about the digital divide, it's not just simply access to hardware, it's access to software as well. And in most CUNY environments where, you have to have some sort of proprietary software to engage in Blackboard or submit assignments and stuff like that, maybe the technology that you have at home or at your cousin's house or at your titi or at your grandma's house or whatever isn't adequate for you to do your work. So putting this money forward, first of all, is important to make sure that the students have the actual ability to do their schoolwork. It's not just giving someone a laptop full stock. It's a laptop that has all the CUNY software that they need to continue their education. And right now, like a lot of parents are struggling just to have access to that technology. It's important that we try to take and ameliorate that issue as best as we can. And again, just putting money forward and making sure that we purchase this technology that is loaded with the appropriate software so people can continue their education. It's not only important for them, but also just to make sure that people feel a sense of continuation and normalcy in pretty extreme and very difficult times.
Yeah. And when we talk about what's going on here in our borough, obviously BCC and many of our educational institutions here in the borough of the Bronx are in communities of color. And there are some huge racial disparities that come when it comes to, this virus. We know that the virus is impacting predominantly, communities of color. And when it comes to testing, that question still begins to loom out there. I know both of you have been very vocal and both of you have been very concerned about that. So give us a little bit about your take on the racial disparities, particularly here in our borough.
When you have an economic crisis, the people tend to suffer the most are the people in the communities of color and the folks who are dealing with the disparate economic climate in times. When you have a health crisis or a medical crisis, the people who tend to suffer the most are the communities that myself and Assemblymember Fernandez represent. And it's not something that's new. It's something that's been predictive, and it is as old as time. Government has to step up. Government has to do a better job in dealing with a lot of the disparate issues, not during only a pandemic when there's an emergency, but also the issues that happen during regular times. We need better access and better technology for our students. We need better schools for our students. We need to equip our teachers with better equipment. We need hospitals that are supported and have the funding that they need to continue to support our communities. We need better resources overall. And again, we talk about the Not 62 campaign, which myself, Assemblymember Fernandez, and the borough president have participated in and pushed forward in pushing that disparity of that the Bronx is left behind in terms of the best economic health outcomes, and then is number one for the worst health outcomes. And this COVID-19 outbreak and epidemic has laid that bare in very, very stark and deep contrast in the rest of our state.
Yeah. Assemblymember Fernandez, of course, we talking to us about the racial disparities too, but then also Give us a little bit about what we're seeing in your assembly district.
Well, my assembly district is, I want to say, surrounded and filled with our most of our hospitals and healthcare institutions. I have Jacoby, Einstein, right outside Montefiore Moses, and North Central Bronx. And my district makes up a lot of essential workers, healthcare workers. So I think that kind of adds to a reason why my district has high numbers of positives, but also understanding that our essential workers and our healthcare workers most of the time are people of color. And, we've seen the I guess the what's the word I'm looking for? The realization that, our essential workers are, now deemed essential. Before it was just service and, low, not so special jobs, a grocery worker, cashier. But now in this pandemic, these are the important jobs. But the people that have these jobs, a lot of the time, and history can tell you, these were the best that, were available to us. These were the best jobs that could provide us benefits and security and all that. So to see that the numbers show that large numbers of Black and brown communities are affected of it, it could be, that I think is added into the history of not getting better accessible healthcare, affordable healthcare, that our communities are food deserts. We don't have, still now, we don't have like Trader Joe's and Whole Foods and stuff. So for a long time, it's been kind of adding up to this moment to now in this pandemic, we really see how it hurt us, how the system has hurt us.
Yeah. Talking about the system hurting us, a lot of people are not happy with the New York State budget, the things that were actually passed. I want to get your take. We've heard several legislative officials say, listen, when it came to the budget, it definitely was not all that we wanted to see happen. Give us your take on the budget, Assemblymember Fernandez first, because when we talked about even cuts to Medicare.
Well, the budget was tough, physically going through it, morally, emotionally, like it did kind of weigh on me a little bit, like what to do in this pressing time where we need to do everything that we can, in my opinion, as legislators to save the public, protect the public. Medicaid was the biggest need, in my opinion, especially coming up to the point of, this pandemic starting. And it wasn't right. Like, I understand that the state is broke. We knew we were low on funds earlier before we started session. And then at the point that the budget had to be passed, we really knew we had no money. But I felt that it could have been negotiated differently. We should have really done everything that we could to make sure that we protected our healthcare in this state, for the fact that we are the epicenter in the country and I guess the world for this crisis.
Yeah.
It was hard.
Yeah, Assemblymember Pichardo?
Well, this is probably in my 7th legislative term that I've been in office, starting in 2013, 2014. This is probably one of the most difficult budget exercises that I've ever participated in. There was a lot of not only bad stuff in this bill, there was a lot of terrible politics. Much of it I did not agree with, especially on this conversation regarding the issue of bail reform. And again, there was this politics that ruled, particularly in the New York State Senate, that for their own politics, they needed to do something to assuage a specific constituency, which, that's their politics. But here's why there were important things in the budget that, if it didn't pass, it would have exacerbated the health crisis. There was about $250 million for distressed hospitals. One of those distressed hospitals, particularly one of the most distressed hospitals in the state, is St. Barnabas. If we were to prolong and push back and go back and forth on this budget process, we would probably lost that money, and St. Barnabas would have had to go down, which meant that the issue of communities of color having less access to healthcare would have been exacerbated tenfold. St. Barnabas is, by the most part, a sort of majority, not only indigent care, but Medicaid population. And the cuts that went forward were terrible, but if the hospital closed, it would have been 10, if not 100 times worse. So besides the bad politics, besides all the other nonsense that was put into this budget, I thought that it was important to make sure that not only government continued to function, but rather that these hospitals receive the money that they needed in order to serve this population. But I will say this, that this isn't the end of this political process. I will look forward to working with my colleague, Assemblymember Fernandez, as many of my colleagues, particularly in the Assembly majority, in making sure that we right a lot of wrongs, but more importantly, when we get back to a sense of normalcy, that we get back to making sure that the priorities of New Yorkers across the state, whether it's in the Bronx or in Buffalo, that we focus on what needs to be done instead of the nonsense politics that took place in this budget process.
Yeah. I got to go in a few seconds, but I want to get your final comments on this issue right here. Small business. I mean, we're hearing a lot of people upset, frustrated about the PPP program and the amount of money that actually came. Small business is the lifeblood of the borough of the Bronx, and it's the lifeblood of America. But when we look, you get Ruth Chris to get to $20 million payout. Last time I checked, I didn't think they were small business.
Yeah, that's a big issue that needs to be fixed. I know there's already conversation with, current congressional members about what to put in the next package, because the problem was that, yes, our small businesses, our mom and pop shops, they didn't get any of this money, and there was no way of them to get the money based on the requirements. I'm hearing with certain paperwork that, almost was impossible, I guess, for them to get. So it's really important that this next stimulus package, CARES package, whatever you want to call it, is broken down, that our small businesses get the grants that they need to sustain and reopen once this is done. So it's terribly critical that we make sure they get it.
Mm-hmm. Assemblymember Pichardo, talk to us about your area, small businesses deeply impacted.
Sure. Well, I represent a lot of taxi drivers, a lot of bodegueros, and a lot of supermarket workers and supermarket owners in my particular district. I was on a conference call till about 11 o'clock at night with Congressman Adriano Espaillat and many of my colleagues in the city and federal level. And first of all, I want to thank the Congressman for his leadership in Washington and pushing that, make sure that we put more money that actually goes directed into small businesses that impact our community. So again, we need to make sure that the federal government steps up, puts more money into these programs, and that it takes away from having sort of the Ruth Chris steakhouses or even the Shake Shack, who apparently returned $20 million in relief that they didn't need, because there were a lot of loopholes put into the first stimulus package that the feds put together. But we need to make sure that we narrow the language and that it actually helps small and micro businesses in our districts, and that we hope to go back to Albany hopefully the next few days or so, to see what the state can do to help support that work as well.
Mm-hmm. Assemblymember Fernandez, before we leave, I want to get an opportunity for you to tell your constituents in your area, how do they get in touch with you if they need resources during this time and season? Although we are not maybe physically in the office, I know the office is still working.
Yes, office is still working. We are open every day, messages, all that. So many ways to contact me. If you call the office phone number, it does get redirected to myself or a staffer, and that number is 718-409-0109. We have an email, district80@nyassembly.gov. Please, send anything to that. Also on social media, you can message either one of the handles on Twitter, Fernandez4NY, on Instagram, Fernandez4NY, and on Facebook, Fernandez4NY.
All righty. Assemblymember Pichardo, you get the final word as to how people get in touch with you in your district.
Sure, not a problem. Again, thank you, Jamie. Thank you, Nathalia. So you can follow me on Instagram, Twitter, Facebook, vpichardo86. You can call me 718-933-6909. You can sign up to our newsletter. We put out a weekly newsletter, talk about what's the issue on coronavirus. We put a lot of information on social media, both in English and in Spanish, so people can follow. But if you have any questions, concerns, issues, or anything like that, you can reach out to our office. You either speak with me or you'll speak with some member of our staff, and we will try to resolve your issue as quickly and as efficiently as possible.
Well, thank you so much for sharing with us, Assemblymember Pichardo, Assemblymember Fernandez, talking to us about, first of all, Bronx Community College. Thank you for the great work and empowering these students. I think they need the great help also during this digital divide. It does make the difference. And of course, for the great work that you're doing with boots on the ground, trying to help Bronxites navigate through something that we've never ever seen before. So thank you both. All righty, we're taking a quick break here on Open. Stay with us. We've got more show coming up right after this.
It looks bleak. It feels bleak. But the city isn't shut down because our public services keep working. In spite of, and in the face of, the dangers, we can count on them. And to keep them working and funded now and in the future, we need to be counted. Self-respond now to the 2020 census at my2020census.gov.
And welcome back here to Open. Daren Jaime here with you, and we are so glad to have you sharing as we continue to talk about COVID-19 and exactly how it affects New Yorkers in a variety of different ways. We talk about health, we talk about wellness, but then we also talk about families. And one of the things that happens during this COVID-19 is that sometimes the families of those who've been infected are really affected in a dramatic way. And so here to tell a little bit more about some of the resources that are available to families, particularly by way of law, is none other than Patrick J. Boyd. He's the founding partner of the Boyd Law Group. And we thank you so much for joining us, Patrick, for being here on Open.
Thank you for letting me participate today.
Oh, no, it's great to have you. And I think it's important that we, have this conversation, particularly for New Yorkers, because as we know, so many people are being adversely affected by corona. And I use the terminology that you're either infected or you're affected. And all of us have been affected, right? But I want to get down to family members of affected people because sometimes in order to deal, you got to be in quarantine or, you're going to have to care for your loved one. And I know that when it comes to sick leave, let's talk a little bit about that because there is some sick leave and there's also, the paid family medical leave. Can you share a little bit about that?
Of course. So certainly the government has passed a series of laws to help people dealing with the virus. And as you say, people helping their families in coping with the virus. There are two primary opportunities for relief under what's called the Family First Coronavirus Response Act. And I'll give you two basic examples. First, if you happen to be sick with the virus or quarantined because you suspect you might be sick with the virus, there's an opportunity to apply for and receive leave up to 2 weeks or 80 hours, if you will, of full paid leave so that you can either heal if you're ill or at least make sure you quarantine yourself and don't get other people sick if you're carrying the virus but not showing symptoms yet, right? So that's one element for you personally if you as an employee are sick. As a secondary item, which is equally important, let's say you have a family member who's sick or under quarantine, or a school-age child who has to stay home, who can't go to school because of the virus. In that case, there are 80 hours available of leave for you to help care for a quarantined family member or to help care for that sick child at 2/3 pay. These are two meaningful amounts of time where you get paid either in full or at 2/3 pay for caring for yourself or quarantining yourself or caring for others who are under quarantine or just caring for your family for that matter.
Mm-hmm. And that's what's so important. It's so vital because I think that a lot of people just have these questions about it. How are employers really responding? What are we getting from, are you hearing that employers are really being sympathetic? Because I know we hear sometimes of some of the challenges, but how are employers responding during this time?
I think there's a fair amount of receptivity to the need for leave out there in the employer community. I would say right now that that's probably easier because you're not dealing with a whole lot of workers, right? You're still dealing with a situation where a lot of non-essential workers aren't necessarily going to work. And so the idea isn't as challenging as it might be when there comes a situation where some of us are going back to work and are sick, or some of us are going to work back to work and some of us can't. I think that the vast majority of the problems, though, are because of a lack of understanding of the law and not necessarily because an employer is out there to try and punish somebody or whatever. To be honest about it, though, an employee can be impacted equally by an employer uninformed about the law or an employer who's being not understanding enough of the law. So it's important for them to understand it. Check out their rights, go online and look at the government resources available to make sure they understand. But the fundamental concept is, at a minimum, if you have the virus or if you have a family infected by the virus, you should be able to expect at least 2 weeks of paid leave, right? Either depending upon 2/3 pay or full pay, depending upon your certain circumstance, whether it's you sick or you just helping to care for your family.
Yeah, great point there too. Talk to me about the CARES Act because we hear a lot about that, and some people aren't so familiar with that. So, give a brief overview, if you will. What exactly is the CARES Act, and how are people taking part?
Sure. It's a new federal law, which is actually probably going to be boosted by more monetary funding this week. It looks like the Democrats and Republicans are agreeing upon that as early as today. But primarily two elements to the CARES Act that are important. First, for small businesses, there's a funding if they choose to keep employees on payroll. They're eligible to apply for 2.5 months worth of expenses associated with payroll and overhead and that kind of thing. So this is an incentive to employers to keep employees on payroll, to keep employees getting paid, and even if they're not working, to make sure that they're going to be working to the extent that they can, and then available to come right back to work because the government is going to cover some of the costs of keeping those employees on payroll. The government's going to loan the money to the businesses, and the businesses are required to use that money and will be required to demonstrate that money is used for payroll, not for something else. So that's an important component. Secondarily, there is a meaningful boost to the unemployment entitlements for people filing for unemployment. A couple of things on that. First, if you file for unemployment, you're supposed to get it like in a snap. It's supposed to happen within days. It used to take quite some time to get unemployment. The government has kicked that requirement and really sped things up. And I don't think they've gotten that perfected yet, but it's made great changes in how quickly that's happened in the short term now. In addition, unemployment is now extended from 26 weeks that you can receive unemployment to 39 weeks. So a longer period of time for that entitlement to unemployment if you lose your job, right? And also a boost in the amount of unemployment you get by $600 a week. So whatever you were going to be eligible for unemployment, you're now going to get up to $600 more per week for that unemployment when you file. So if you lose a job, as they're saying, 20% of the population is now going to lose their jobs. If you lose that job, and I think in New York, that's going to be a much higher number. I think you would probably agree, right? If you lose that job, you have the ability to file for unemployment quickly and to receive that benefit of $600 or more per week for up to 39 weeks, which should provide not a luxury, but at least a necessity of income for people who lost a job through no fault of their own, which is an important benefit.
Yeah, and it's sad, but so many New Yorkers are really filing for something. It's unemployment. It's that paid leave. It's the family's leave. Everybody needs these resources, right? Because particularly here, being in the epicenter of what's going on, it's also important for people to be able to tap in. I did want to talk a little bit more about the the Families First Coronavirus Relief Act, because there's another act that's out there as well. And so many acts, right? But it's great that there's this amount of help that's out there and available to people. So give people an overview about this one as well.
Well, so we were talking about that Families First before. I think the one thing that perhaps I didn't mention when we talk about it to start with is just that the eligibility is going to be contingent upon the size of your employer, right? And it's also going to be contingent upon an important component, which to be honest, the law is still evolving on this because these are new statutes, right? But the eligibility is going to be something that we have to figure out practically if you're capable of teleworking. So for particular people who maybe have a job where they're required to be in a factory or on a floor setting or in the field, it's very easy to understand that benefit of those 2 weeks of pay is going to be available. But for those people who might be clerical workers who have the capacity to telework, that benefit's not going to be available unless you can really show that you can't telework from your job. And that's an important component just to consider in terms of how people are going to get the benefit and not. I think it's concerning to a certain extent for those people who might have jobs that are jobs that they could telework from, but maybe don't have the resources, maybe don't have that computer, maybe don't have that iPad, maybe don't have that technology for teleworking. And how that's going to play out, I don't know, and I don't think we know yet. In terms of what's going to happen.
Yeah, so much to pay attention to. But one thing that we can look at with very, a good lens is the fact that this is disproportionately affecting communities of color. and that plays out in a lot of different ways. And I know you have some thoughts and some things you would say towards that.
Yeah, well, for sure. I think there's two groups that have to be particularly vigilant at this particular point in time. It would seem the African American community, most of the scientific data is showing that they're adversely impacted by this virus, which is concerning in and of itself. And then the Asian American community and the Asian community, where certainly there has been some discriminatory animus directed towards Chinese and the Chinese government by virtue of this whole virus. I think the most important thing to say on that score is the following. I would love to say, and I'm sure you would love to say, that everybody's going to do everything they can to get along and be fair and be reasonable. But racism doesn't disappear because of COVID-19. Sexism doesn't disappear because of COVID-19. And all those types of discriminatory things that people have faced in the workforce, they might still face. And what's most important, I think, is that workers don't forget that their civil rights are still intact and still available. If you feel that you were let go because you were pregnant, or because you were African American, or because you were Asian and traveled to another country and your employer just didn't want you back in the office as opposed to somebody else, there are laws that have been here since at least 1964 that are designed to protect you. And the employer can't say, oh, well, COVID-19, so I'm letting you go. That's not good enough. Those civil rights protections do not disappear for workers, and workers shouldn't think they're just getting along, and should just get along by forgetting to consider their rights and their opportunities as members of protected communities if they're let go, or if they lose their jobs, or if they lose their jobs and realize that the people who kept their jobs are all Caucasian or all non-Asian or any of those kind of things. So I've heard a lot of concern, in particular in our firm, with calls from pregnant women who say, well, maybe the employer is just trying to look out for me because I have a baby and they want me to be healthy and they're worried about me. And I understand that, but pregnant women need jobs.
Right.
Need jobs perhaps as much, if not more than a lot of people, because they've got a new baby on the way. So I hope that people will get along, but I hope that people won't forget that those rights and opportunities that they have as part of the civil rights laws of this great country, don't think that those rights disappear, or don't think that they have to minimize those rights just because they need to get along in this particular society. It's going to be very important that we push for those rights and opportunities for people now, where it might be easy to marginalize that issue because you just all want to get along in this difficult time.
Right. Patrick J. Boyd, who's the founding partner of the Boyd Law Group. Thank you so much for being with us and sharing with us here today. A lot of helpful information. Hopefully, we got your information at the bottom of the screen that New Yorkers can be able to tap in a time such as this. Thank you for the great work that you're doing and keeping us aware. Thanks a lot.
Thank you. Take care of you and yours.
All right. Patrick J. Boyd of the Boyd Law Group. Stay with us. We've got more open. We're coming right back right after this.
Why should young people care about the spread of coronavirus? Well, we know that people with underlying medical conditions over the age of 60 are at highest risk, but they've got to get it from somebody.
So we're asking everyone to be selfless for others so that we can protect those who are most susceptible.
Not going to bars, not going to restaurants. It all just means physical separation so that you have a space between you and others.
For more information on how you can social distance, please go to coronavirus.gov.
Well, as New Yorkers are battling and trying to deal with COVID-19, one of the things that we're trying to find out is how is the best way that we can actually stay healthy during a time such as this? How do we boost our immune system? How do we keep our bodies in the best possible shape to try to avoid contracting COVID-19? And even for those who do have COVID-19, how to deal with it. So joining us a little bit to talk about this right now is a very special guest, Dr. Rosanna De La Cruz. She's the owner of Washington Heights Wellness, and she joins us here on Open. And Dr. De La Cruz, good to have you.
Thank you for having me. It's a pleasure and an honor.
Yeah. And I think your voice is so critical, like during a time such as this, because so many people are trying to do their best to make sure that they're staying healthy. And when we talk about staying healthy, one of the things we talk about is our immune systems. And so I know that, that's your specialty and dealing a little bit with immune system support, but can you talk a little bit about immune system and how the virus actually does affect the immune system?
Absolutely. So our body, I always say to all my patients and everyone that I come in contact with, that the body has the ability to heal itself, and we, for the most part, are born healthy. So the immune system is, it's always working for us, and during these times, it's extremely important that we do the right thing to support our immune system, our nervous system, and also our hormonal system. They all work together, and they all affect each other. So I very simple tips that we can use to stay healthy to boost immune systems are usually pretty easy, and we don't have they're not complicated. They're simple. They do require for us to take some effort, but they are simple, and we can start doing them today. We don't need to go anywhere. So I will be happy to share some of those with you.
Yeah, so let's walk through a little bit of this here because there's some steps that we can be taking, some healthy steps that we can be taking, right? And so we know the basics about washing our hands, right? So give us a little bit more about beyond washing our hands and keeping our hands washed. But even for that, I found that so many people don't even know about the proper way to wash hands. So let's go over the proper way to wash hands.
So 20 seconds, usually if we sing the ABC or the alphabet is a good enough time. Definitely we should have soap, because just washing our hands with water is not enough. Thankfully, this virus can be avoided by having the proper hygiene. We now know that the points of entries for this virus are our eyes, our nose, and our mouth. This is where it's easiest for us to get exposed. So at this point, it's extremely important that we use a mask and even sunglasses. And if we are talking now that we are having social distancing in place, that we know to keep our mask. So with washing our hands, it's pretty simple, and it's very important. Every time we come inside our house, no matter if we think we didn't touch anything or we had gloves, it's extremely important that we wash our hands and we disinfect all surfaces that we touch on our way in. But those are very easy ways that we can prevent exposing ourselves or others in our house to this virus.
One of the things that people talk about is sleep during this time, right? It's important, but let's be honest, sleep habits are actually being challenged right now, right? When you look at the average person is spending more time at home, it's hard to get into a normal sleep routine because either I'm watching TV a little bit more, or I'm spending too much time doing other stuff. So that sleep routine, how important is a sleep routine in a time such as this?
It's extremely important, specifically nighttime sleep, because there are specific hormones that only regenerate at night. And not only because it's hormones, but the hormonal system aids the immune system. So our body only heals during sleep. And this virus is like going to a war, right? We have this battle, which is the virus, and we have to be prepared in every way possible, like warriors, to see who's going to be stronger, the virus or our immune system. So at this point, although it is difficult to create routines, that's one of the simple things that we can do that requires us to put some effort. So turning off the TV when it's time to go to sleep. It's been proven that 10 o'clock at night is the ideal time to go to sleep. And if we have the habit of not going to sleep at that time, start cutting 15 minutes every night will help until we get into the rhythm. It is very important to get a very good night's sleep. Another core asset, as I call it to my patients, is hydration. When we stay well hydrated, everything flows better. Less bacteria and virus can attach to organs and tissues. We actually have more energy, and all of our bodily functions are more prepared to deal with anything. It's not only this virus, but we have latencies and chronic disorders that have been accumulating. So this is not only during the coronavirus, but it's extremely important to keep that hydration and sleep on point. The other thing that we can do is cut processed foods, try to eat as whole as possible. including sugars. Sugars are known as being pro-inflammatory, which are also going to impact the immune system. So if we can cut sugar and processed foods from our body, we are already helping the immune system.
Amazing information there. Before we go, let me ask one question. If a client is talking to you right now and they're saying, listen, I'm really concerned about this, what would be your immediate advice to just tell them and help ease them through a time such as this, knowing that we're seeing the massive amount of numbers like we see in New York City of people being contracting as well as being, but we're seeing healthy people being, I should say people being released too and coming home. But what would you give them? What would be the main piece of advice that you would share?
The main piece of advice is to remind them that we are resilient and that this too shall pass, and we're going through it together. And by taking care of ourselves is the way that we can fight panic. Panic is also going to suppress the immune system and fear. So we have to stay grounded, having some mindsets every day, have a time for meditation and prayer. And third, telemedicine. There are lots of practitioners out there helping not only with mental health, but also with natural medicine. We are offering telemedicine to our patients. They can go to our website and request a free consultation. It's completely free. So that's what I would say, to look for help and to remember that we are resilient and this too shall pass, and we're going through it, all of us together at the same time.
Certainly appreciate you, Dr. Rosanna De La Cruz. She's the owner of Washington Heights Wellness Center. And of course, thank you for the work that you do and helping others to stay well. Thank you for being here on Open.
Thank you, Jamie. Have a wonderful day. Stay safe.
No problem. Dr. Rosanna De La Cruz. And listen, we've got more Open. Stay with us. We're coming right back right after this.
When taking public transportation, don't touch your phone. Carry hand sanitizer and use it immediately upon leaving the bus or train. Avoid touching your face. If someone is coughing or sneezing, move away. Wash your hands with soap and water as soon as possible. Limit contact with poles. If possible, avoid rush hour. Don't eat or drink on public transportation. Keep your bag off the floor or other surfaces. Avoid directly touching turnstiles. Stay up to date with the latest from your local health department and CDC.
And welcome back here to Open. Daren Jaime here with you as we continue to bring you the news, the information, the things that you need to know. Of course, we're not in studio, but we are coming virtually. Glad to bring you much needed information and content for such a time as this, as information is key in really communicating with Bronxites and New Yorkers to let them know how we're navigating through this whole COVID-19 thing. One of the tragedies in COVID-19 is that of the lives lost. Thousands of lives lost here in New York City, and the questions continue to mount. Funeral directors, burials, and we also know about Hart Island, an island that has been home now to many burials for those who are victims of COVID-19. Here to share a little bit more with us about the burial process, how families are doing, and also what happens in that time of death and some of the assistance that's available, is a very special guest of ours. We're pleased to be joined by Melinda Hunt, who's the director for the Hart Island Project. And we thank you so much for joining us, Melinda.
Thank you for having me.
Very important. And thank you for the great work that you do. We're getting into it right now. But for people who don't know a little bit about the Hart Island Project, please share with us.
The Hart Island Project is a public charity that assists people in getting information about the burials on Hart Island and also gaining access to visit grave sites of their loved ones and friends.
Yeah. And when we talk about that, we're talking about people who've been affected by COVID-19. Now, traditionally, before that, Hart Island served a different purpose. And now it seems as though with COVID-19 and the rapid amount of deaths, they're using Hart Island as that place to really put people's loved ones. Talk about what's going on now on Hart Island as opposed to what used to be before.
Well, In fact, I don't think it's a lot different than before. New York City has had quite a number of epidemics since Hart Island burials began in 1869. The system of burials that is used on Hart Island was developed during the American Civil War to bury Union soldiers on battlefields such that they could be disinterred and either returned to their families or buried in national cemeteries. So it has a historic relationship to African Americans and to people in New York City who, for whatever reason, did not retain a funeral director. So if your family is low income and lots of people are unemployed today, and you can't afford a funeral director, then the city is required to provide a decent burial for all unclaimed bodies. And this system of burials, it looks terrible in the videos, but in fact, I've been working on Hart Island to monitor these burials for almost 30 years now. It'll be 30 years in 2021. And when I look at the current video, I can see a very well-organized system of burials where each body is placed within a plot. There are 150 bodies in each plot, but the city does know exactly where every body is, and each body is handled as an individual. So I think there's no reason to fear a city burial. And I also think that more than ever, this is going to be the choice for most New Yorkers. And so it's up to us to make sure that this cemetery becomes a beautiful parkland. It has already been transferred to parks. Prisoners used to conduct the burials. That ended on April 3rd. For 150 years, the city has used prison inmates to bury the unclaimed dead, and that is over. We're done with that. Mm-hmm. And I think it makes it a lot better for people to know that the city has hired private contractors, just as all the other cemeteries in New York City use private contractors to actually inter the dead. So
can you, I want to just cut in here because you mentioned something that seems a point of interest for me. When you said that there's a possibility that this will be the way of choice for many New Yorkers possibly going forward. Can you elaborate on why you think so?
Well, before this all started, the least expensive, even cremation, direct cremation with no ceremony and nothing, was $1,700, $1,800 in the city. The private cemeteries, burials start at $20,000 or something like that. So maybe you planned ahead and you've got a private plot at Woodlawn or Greenwood or St. Raymond's. But you have to, in order to get your loved one from wherever they died into that plot that you purchased, you have to have a licensed funeral director. And the funeral directors are all overwhelmed and unable to take bodies from the morgue, pick them up at the morgue, and they're not having any kind of gatherings or funerals because of social distancing, and crematoriums are all backed up. I've heard that you can't get a cremation until the middle of May now, and the medical examiner is entitled by law to bury any body that is not collected within 7 days. The mayor has extended that to 15 days. But essentially, if you don't have a funeral director that is really dedicated to your family and that kind of a connection, you're not going to get a burial other than on Hart Island. And in my opinion, Hart Island, I've been going there since 1991 during the AIDS epidemic. That's how I started going there. It's much better than it was in that they've ended inmates conducting these burials. And it's actually a more orderly system of burials than what you're seeing happening at funeral homes at this point. So I don't think people should be afraid.
No, I get not being afraid. I think admittedly there's some, I guess there's some emotion attached to. I think when you come to the place of disinterment, right? Because you've got a family member that may be put there. We know that there's 14 days that you have, and that whole thing of going through that, the emotional, the
Oh,
psychological load.
terrible.
So
Oh,
yeah,
terrible. And also not getting to say goodbye to your relative if they're in a hospital, not being able to gather your family, not being able to do anything at this point. And maybe having lost your job and being short of food and worried that other member of your family are going to get it because you're all living in the same tiny apartment that you were before this started. I mean, it's just a horrible situation for families. So the only the it's going to be the only option for many, many, many people. So you're not alone if you can't find a funeral director at this point and you don't have any other options than to agree to a city burial. But the flip side of that is that the city does know where everybody is on Hart Island, and later on you'll be able to request a disinterment if you didn't agree to a city burial. The trouble is that if there are a lot of disinterments, it's going to take a very, very long time. And in the meantime, the Parks Department has taken over the management of Hart Island, and it's already pre-approved as a National Historic Site. And I think there's an opportunity for it to be a very good place to be buried for people. So it may not be your first choice, but it's a very orderly system of burials that the city has capacity, and they manage these burials quite well at this point. So that's just my
well,
limited
Melinda, we want to
experience.
thank you. I mean, it's a hard decision. It's hard work that goes on invested into this. Thank you for the work that you're doing in a very sensitive and delicate way. There's a lot to navigate through this. For families, of course, we understand that there's some great challenges. We put the information up at the bottom of the screen, of course, for people to be able to get connected. If you do need assistance in finding burials and you've got limited resources, of course, want you to get a chance to reach out to Melinda as she continues to do great work with the Hart Island Project. Melinda Hunt, thank you so much for sharing with us here on Open. Thank you.
You're very welcome. Thank you for having me.
All righty. Well, we want to let you know that about wraps it up for this particular edition of Open. We want to thank all of our guests for joining us, and most of all, you, the viewer, for tuning in. Now, if you missed any part of today's show, don't forget you can catch the recablecast tomorrow on BronxNet's Channel 60. Well, today, I should say, at also 5 and 10 p.m. on BronxNet's Channel 67, Verizon Fios Channel 33, and also on the web at bronxnet.org. Again, on Thursday, those same times as well. And so, listen, for all of us here on Open, we certainly want to say, stay safe, be encouraged. Before we leave, want to give special prayers and thoughts and condolences to the family of our director, Nicholas Marrero, who lost his father just recently this week to COVID-19. Nick, my brother, wants you to know I love you. We love you. We're praying for you. Continue to stay encouraged in this rough time and in this tough times. We are going to get through this together. For all of us here, as we said, God bless you. Everybody take care. Stay safe. Rita Valentine will be back with a brand new, fresh episode of Open on Friday. Until then, God bless.